So army medics are now moving in across Gauteng as COVID cases continue to skyrocket. Extra beds are being made available, but it's believed there are at least 2 weeks to go before infections peak in Gauteng, and hospital capacity is already over 70%. Let's talk now to Professor Guy Richards. He's the former head of critical care at Maxeke, Johannesburg Academic Hospital, and he is an emeritus professor at Wits University. Professor, thank you so much for joining us. I wonder if you can explain something for me. We keep hearing stories from desperate members of the public here in Gauteng saying they cannot get a hospital bed for their very sick COVID patient, friend or family member. But the Premier is saying hospitals are only 70% full. Can you explain that?
No, I can't, because it's obviously not correct. The hospitals are all completely full. If we talk about the public hospitals, as we know, Charlotte is closed. Chris Hani Baragwanath is full. They're already full with patients that should have been managed at Charlotte, and of course they can't. Califong is full. Helen Joseph Hospital is 110% full, and they've got patients in tents outside. Bertha Klauer, the old Germiston Hospital run by Charlotte doctors, is full at the moment. There are no beds in private, and certainly I get appeals all day to try and use influence to get people admitted to private hospitals. They have opened 4 beds at the field hospital near Chris Hani Baragwanath Hospital, not 4 beds, 4 wards of 25 each, and that's being run by Charlotte staff there as well. But in fact, there are another 16 wards that could be open but have not been commissioned. And all of those are full already as well, the 4 that are being run by Charlotte. So it is, as Glenda Gray said earlier, it is a catastrophe. We don't have place, and hundreds of people are actually being treated at home with oxygen. And that's not a good system, because if they deteriorate, then they have no access to an ICU or further therapy thereafter. So it just is a disaster.
Is it going to get worse? We are told by Professor Bruce Malado he puts the peak in Gauteng at the end of this month, early next month, and we know that infections sort of run 3 weeks ahead of hospitalizations. Is it still going to get much worse?
Probably. I mean, it's always difficult. This is a virus that does its own thing. We cannot say definitively when it's going to peak or not. Today, I see is 9,160, and 2/3 of that, 6,000, are in Gauteng. Now, that's down slightly from previously, but it just depends upon a lag from the weekend or other factors like that. And you can't really tell until you get a definite downward trend on 2 or 3 days afterwards in order to say, okay, yes, we now are peaking or plateauing. But it is a remarkably infective disease, and really the only important thing at the moment is to be sure that one doesn't get the disease and try not to go out and treat yourself as a level 5 lockdown. Avoid getting sick because there isn't a bed for you.
So talk to us about ICUs. I know that this is an area of specialization and you really understand the intensive care environment. What is going on in the average ICU at the moment? I mean, we're hearing about oxygen shortages. We're also hearing about ventilator shortages. Paint a picture for me.
So the prime problem is that the wards can, in general, only supply oxygen, but they've been upgraded in many circumstances to be able to facilitate the provision of oxygen by means of other systems like the high-flow nasal cannula or even CPAP masks. But this is being managed often by non-ICU people because there aren't enough ICU people to manage the wards. In the ICUs, only the most critically ill people actually get access, and those are people in general that have been intubated, they have had a tube put in their throat, and they have been attached to a ventilator, and they often will remain on that ventilator for some time. And the trouble is, of course, that once you've got a patient ventilated, is that they block the space. And you then don't have any further space to intubate patients if they actually require it. So people are working remarkably hard at the moment and very little time off. And the stress for the doctors and the nurses that are involved on a day-to-day basis is enormous. And the burnout that has been documented both here and internationally has been something that has perhaps been underappreciated.
Yeah, absolutely. I mean, one shudders to think what people in the front line are going through this evening. Talk to me a little bit about the Beta variant, which was first discovered here, and the Delta variant, first discovered in India, which I understand is circulating here as well, not as much as the Beta variant. We know that they are more infectious, more transmissible, I think is the right word. Are people getting sicker, or is it just that there are more people needing help at the same time?
It's almost certainly because it's both are more transmissible. The issue is that if you get 10 patients and only one of them is going to get severe disease, if you then get a virus which infects 100 patients instead, you're then going to get 10 patients who are going to get severe disease and end up in ICU. So it's more people who are getting ill, and the proportion of people who get severe disease or that requiring an intensive care goes up as well.
We have got, I think, just the first lot, I think it's 60 medics from the Army that have been released. I understand they're going to be working at that Barra unit, along probably with some of the Charlotte Maxeke staff. Do you think the Army is going to be able to make a significant difference? I know that there'll be more and more medics coming in, but do you think that is the right decision to have taken at this time?
I think it is, because as I said, there's still 16 wards that could be opened and commissioned in that facility. And it's a very nice facility, and there are a number of ventilators available, and there are oxygen ports. The problem at the moment is that the ventilators are not really able to be used because there are no ICU-trained sisters in that environment. So we hope that the Army will be able to provide ICU-trained sisters, or at least people that know how to manage ventilators overnight in that environment as well.
You say that you've spent your day fielding calls from people desperate to get a hospital bed. I wonder if you could tell us what you're telling them and what your advice generally is to people who are anxious or perhaps even ill this evening.
Well, in many circumstances, the most important thing that those people need to know is what their oxygen levels are. And the best thing to do is, if you can access a saturation meter, a sat meter, and actually see what your oxygen levels are. It gives you an idea of how sick you actually really are. Because the only measure of how ill you are is how much oxygen you are going to be requiring, given the function of your lungs at the moment. So the important thing is, if you can access one of those, then that's important. If you're extremely short of breath, then that also is an important marker of severity. And then it's very important at that time that you get to a doctor who can provide the correct therapy. Because far too often people are being administered drugs which have not been shown to work, such as ivermectin, such as antibiotics, such as all sorts of things like Tamiflu, which is for influenza, none of which are effective in terms of COVID. And the important thing is that they get corticosteroids in the setting early if they have low oxygen levels or are extremely short of breath and don't have access to oxygen.
All right, so when you say a sat meter, is that an oximeter? Is that the same thing?
An oximeter, yes.
All right. What are the danger levels that we need to keep an eye on for those monitoring their oxygen?
Well, it's nice to know what your resting oxygenation level is now. If that starts dropping, and if it decreases certainly below 90 in Johannesburg, because our saturations are a little lower in Johannesburg, if it drops lower than 90, that it already is a danger and a warning sign that there is a problem. But do remember that these sat meters are not particularly accurate anyway, the ones that go on your finger. And as a consequence, it's good to know what normal is for you, if you possibly can, prior to contracting the disease. So then you can see whether, in fact, you're declining or not, because the meter might actually not be well calibrated and give you a lower reading just because of that fact.
All right, and as you say, while it is very difficult to get a hospital bed, it's important to speak to a doctor and rather Antibiotics are not going to help you. Ivermectin is not going to help you, but a corticosteroid might help you. You need to speak to your GP, at least consult. And we know that a lot of the GPs are hard at work doing telephone consultations with people who are isolating at home. And I just want to thank you so much for your time this evening. That is Professor Guy Richards, head or former head of critical care at Charlotte Maxeke Johannesburg Academic Hospital, and he's an emeritus professor at Wits University.